As we continue to see COVID-19 numbers grow across the state of Alabama, we've invited State Health Officer Dr. Scott Harris to talk about what's going on. He joins us now. Good evening, Dr. Harris.
Hello, good evening.
We now have over 30,000 cases of coronavirus across the state of Alabama. I know the state has increased testing around the different counties, but how do you explain the large increases in COVID-19 cases?
The increase in the numbers we're seeing is not explained by an increase in testing. It's caused by the number of disease transmission events that are going on in the state. We're seeing large numbers of cases that are arising sometimes in workplaces or in skilled nursing facilities, but sometimes there just seems to be community transmission going on.
Montgomerys mayor issued an executive order last week requiring residents to wear masks to help prevent the spread of the virus. Should more be done at the local level, like here in the Wiregrass?
I think that's certainly an important consideration for local officials. I commend the mayor for doing that here in Montgomery. He felt that that was the appropriate thing to do, and given the amount of disease transmission here, I believe he was correct, and I believe that what he did will prevent illness and save lives. I think local officials are going to need to make that determination. We're trying very hard to get them the information they need to understand the amount of disease transmission that's going on in our state. We have a number of counties in Alabama now that have very high rates of transmission. And even though the smaller counties may not see absolutely large numbers of patients, the rates are very concerning. And I think many public officials need to consider whether face coverings or other types of measures ought to be enacted.
We continue to see that the vast majority of deaths in our state are older residents, particularly those in nursing homes. What is your team doing to stop the spread in those facilities?
Yeah, we work very closely with the nursing homes to make sure that they have stringent infection control measures in place. They are doing a very good job of that. Many nursing homes, if not all, are doing testing or at least symptom reviews for all their staff and all the people who are coming in and out of the building to make sure that no one who's sick comes into the building. The Nursing Home Association is working with us and with all the facilities in the state to enable testing of residents in the state as well as of staff. Visitation continues to be limited in these facilities, and we know that's a hardship on people. We certainly don't like the fact that people aren't able to see their loved ones and have been separated from them now for a few months. We hope that we can make some arrangements soon so that visitation can resume in some form. But unfortunately, right now, it's still very unsafe to our nursing home residents to have visitors coming in and out of the building.
Moving from nursing homes to schools, we know that Dr. Eric Mackey is expected to announce his K-12 roadmap later this week on how schools plan to proceed this fall with a return to learning. What guidance have you provided Dr. Mackey and superintendents across the state?
We work very closely with Dr. Mackey and with his team. We've had public health represented on his strategic planning team that's developing the return to school documents. I know he's discussing that with superintendents this week, and we'll make that fully public later on in the week. We've tried to help them develop strategies around some very basic public health measures that ought to be in place everywhere in schools or anywhere else. We want people to be very careful about hand washing and sanitation. We want to try to encourage social distancing to the extent that that's practical. Certainly not always practical in the school setting. We think that people need to stay home if they're sick, and when you have kids who are ill, we want to be able to make sure that they're isolated from other kids as quickly as possible and that they get appropriate care. So I think there are a number of just sort of common sense precautions that will be encouraged. Ultimately, I think local school boards and local superintendents are going to be the ones who are going to have to make those decisions. We realize that every school district is different, but we're going to do our best to give them the best guidance and advice we can.
Lastly, Dr. Harris, we are over a month into the Safer at Home order, and we have now seen a surge in cases that we've talked about in several parts of the state. Should the governor issue new restrictions right now instead of waiting until the current order expires?
Well, we're having discussions with that and are trying to present all the policy options that we have to the governor for her to consideration. She has a number of things to consider, not only the public health of the state, which I'm sure everyone would agree is the most important thing, but also other important factors related to the economy and to jobs and other things as well. So we're trying to present to her the best things that we can. I think she'll probably say something at some point soon before the July 3rd health order expires. It seems likely that we're going to certainly not become less stringent for sure, but we'll know more about that hopefully in the next few days.
All right, Dr. Scott Harris, thank you for talking with us and keeping us updated.
Sure. Thank you for having me tonight.